With Josh and Paul and Michelle Siegel, Commissioner of Consumer Protection. A lot of talk the last week or so about locking down and opening up and the rules. Rules are only effective if people understand them and want to follow them and obey them. And Michelle has been on the front lines in terms of enforcement of a lot of our rules regarding stores and restaurants and the such. So happy to take some of your questions. But first, let's talk about the daily summary. What do you see here? You see a lot of tests, third highest in the country, making that a focus. Positivity rate, I've focused on that over the last year. Now I'm just seeing it's a number that jumps around a little bit. I'll show you the trend line in the next chart, which I think is much more meaningful. But 6.6, 7-day average 6.8, so I think you see sort of where we've been for a week or so. Hospitalizations, again, a number that's jumping around. Down 48 is a big deal. I mean, that means we have the same number of people hospitalized today as we had a little over a week ago. And in the last 8 days, 4 days have been up and 4 days are being down. And if you want to know why it jumps around a lot, ask Josh in a few minutes. Fatalities, continuing to be a lagging and tragic indicator. Next up. This chart, I think, is just a reminder of trend lines rather than looking at the data of the day. The yellow is the positivity on a 7-day average. And you can sort of see, since November 20th to December 10th, in and around that 3 weeks, down and up. So it is varying and not going up the way it was before, but it's worth looking at the fact that it's gone up a bit over the last 5 days, and you may see that reflected in hospitalizations over the next week or so. And this is the way we measure exactly how we're doing in terms of capacity and what we try and predict in terms of 2 or 3 weeks out. Next chart is for me, the history buff, but yesterday was a tragic day in the sense we had more fatalities than we've ever had before, going back to the spring as well. 3,055. Give a little context on that. I don't know what the Galveston hurricane was, but Antietam in the Civil War, that's 3,600. We were on both sides of that, Americans were. September 11th, a little under 3,000. And then last Thursday, last Wednesday, last Tuesday, and last Friday were some of the deadliest days in American history. Enough of that. Let's talk about the vaccine. A little more optimistic there. I think you know the news. We tracked that pretty well with Deirdre and Reg last week. Just a little update on where we are and what has changed in the last few days. We're waiting to hear on the FDA committee any hour now. That's the Vaccine-Related Biological Products Advisory Committee. They're the ones that say it's safe, and they are going through the process. You know that Britain has already said the Pfizer vaccine is safe, and they are already vaccinating people. You know that Canada has done an independent appraisal as well, so we're getting some verification there. And you probably know that the second person, thousands of people are being vaccinated every day in Britain. The first lady was 90 years old. The second person was named William Shakespeare. Friday, we hope to get the green light and the emergency authorization. Shipments will begin hopefully soon thereafter. We're counting on Monday, Tuesday. In the state level, let me tell you what we're doing. We've got the communications subcommittee. That's really important right now as we're going into the community. That's labor, that's business, that's political folks. Those are religious leaders. It's really important that they are getting the updated information and taking that out to the community so when the vaccine is available to you, that you'll be ready and willing to take it and do it safely. And a lot of questions are coming back to the communications people from folks on the ground. And we have our scientific subcommittee made up of infectious disease experts, epidemiologists, and as such. So we're able to get the very best scientific information to you via our different communications groups out there. And I'm watching this carefully. Max is watching this carefully. We look what's going on in Europe. There's a lot of cheap rumors going on in social media and the internet trying to scare people, and we're doing everything we can on our side to give you the very best scientific information every day that we can. First clinics are probably going as soon as next Tuesday, provided we keep to this schedule. Let me tell you how it's getting distributed real fast. I told you about Phase 1A, those frontline workers, the nurses, the docs, the healthcare professionals, folks in nursing homes, nurses in nursing homes. These is where we're making our priorities. So Pfizer, very soon, over the next, 3, 4, 5 days, will be shipping to our hospitals. And there the hospitals will allocate according to need, probably focusing on the highest risk employees first. Highest risk are those who are most likely to be dealing with folks, with COVID, making sure that those nurses and docs can stay in the game. The lower side is what we're doing for the nursing homes, and there those shipments are going via CVS and Walgreens, their distribution centers, and then from there, on ice, going right to the nursing homes on site, and that's probably going to be another week away, say December 21st, that we'll start those vaccinations. That's important, though. Within a week or so of those vaccinations, 2 weeks of those vaccinations, you could see lower infection rates. That means more folks at the hospital able to take care of you, and less people in the hospital because some of the elderly folk are less likely to get, with the vaccine, less likely to get infected, less likely to get into the hospital. Another slight change of pace, but I just thought it was worth noting, is the bond ratings. All of the 50 states are in different levels of fiscal duress right now. We continue to see if the federal government's going to step up. But I was really pleased to see that Connecticut had its bond ratings affirmed. I know that's sort of technical, and you say, how does that impact me? But it says a message to the people around the country, and hopefully to you, that given the tough circumstances, our fiscal house is in order. Fortunately, they take strong note of our rainy day fund, which we call the Budget Reserve Fund. And this is across all the different rating agencies. And that's an important benchmark as people look at the state of Connecticut. And it's not true of everybody. I mean, I like to do things on a regional basis, as you know, but, New York and New Jersey, they took a little bit of a hit. Some of the energy states that are out there right now, they took a hit for reasons you can understand. Oklahoma, Wyoming, Alaska, those states that have a lot of tourism, say Nevada. So there are different states, red and blue states. There are different fiscal states right now. And I'm pleased to see that Connecticut is one of those states that had its ratings affirmed. Let me just go right to this chart. I thought it was interesting. I think you know GoFundMe on Facebook. It's one indicator of the generosity of people. This has been an incredibly generous time in our state and in our country, I'm pleased to say. And what that means in terms of Food Bank and Food Share and their donations, they're merged, by the way. What that means in terms of folks in Step Up Connecticut, giving with their, giving with their person as well. And this is sort of interesting. Of the 50 states, Connecticut's number 6 most generous in the country. Not bad. I'm a little jealous of Massachusetts and Vermont, but I can tell my friend Andrew Cuomo, keep catching up with us, buddy. Anyway, I just wanted to give you that news. And let me just ask Michelle to take a couple of minutes to tell us what you're seeing in terms of enforcement, what you're seeing with all the local public health officials, and what they're hearing. Michelle Siegel.
Well, thank you, Governor. Overall, we're seeing, and it's been good to see, that the vast majority of our businesses and our citizens are complying with the rules and trying to do things correctly, and that's hugely important. But unfortunately, there are the outliers. There are certain businesses that are hosting large events, are letting people in, not social distancing, not wearing masks. And so we've been really pleased to have this good partnership with local law enforcement, local health officials, where if it's somebody who has a liquor license, and that comes with certain responsibilities and expectations, that they're letting us know when these businesses are contributing to the problem. And when people go to these places, you're not just putting yourself at risk. It's communities, the healthcare workers who then have to deal with hospitalized patients. It's also not fair to all the other businesses that are following the rules. So we did suspend another liquor permit today, and this was a place that had well over 100 people on a dance floor, not appropriate social distancing or mask wearing. And while I'm glad that's certainly seems to be more the exception than the rule, and we know it's a tough time for businesses and appreciate that so many of them are stepping up, and we appreciate our partners at the towns letting us know when places are not.
Thanks, Michelle. Over to you, Max.
Channel 3 Eyewitness News.
Yes, Governor, 14,000 teachers are calling on the state to do more when it comes to safety. And one of the things that they're asking for is statewide safety standards rather than the ones that are currently just created by the districts. What can be done for them, and what is your response to that petition that was sent today?
I'd say back in May, June, we had all the teachers, in fact, leaders of the teachers' unions on our reopen committee, including the schools, together with other advocates and superintendents. They put in place a clear set of guidance and rules. This is going back many months in terms of what we could do to keep our schools safe. At that point, Melissa McCaw asked the superintendents, you've seen the guidance in terms of public safety. Tell us what you need financially in order to get that done. And they submitted their budgets, and I think she was able to answer their questions, provide the funding they needed so that they'd be able to open the schools safely in September, which they did. So, for that, I'm very happy. Look, that said, I've talked to a couple of leaders. They said, okay, the overwhelming majority of the schools are maybe doing okay, but there are some outliers. Take care of those outliers, just what you heard Michelle say. And I called Miguel and Cardona, our Commissioner of Education, and if there are a few schools that aren't taking the protocols as seriously as they should, they are now.
Now, there are some within your own party who are calling on you to do more when it comes to restrictions, but how effective would this be if neighboring states didn't follow along? Like, do you foresee another regional approach when it comes to making a big decision like this?
Let me put it this way. I saw some of the press that said, hey, Gina's in a pause. Why aren't you in a pause, just like Rhode Island is? Well, they brought their bar capacity down to 33%. We never opened our bars. I see that Charlie in Massachusetts has got a pause, and he said no performing arts centers open. Ours haven't been open. Down in New York, I do know that New York maybe is looking at bars and restaurants in New York City, but not in Westchester County and in Rockland County. So I think what you're finding is there are other states are, following along, and I think we're going to be pretty close in terms of where we are in those protocols, especially after those small changes from the other states that I mentioned. But you're right. If things continue to get worse instead of better, and we think we have to do more in terms of protections, we try and do it.
News 8.
You consider a rollback to phase one like we had in the spring, or are you going to adjust it depending on the numbers, like maybe restaurants versus gyms, that kind of thing, or are you just going to go back to phase one if you do go that direction?
Look, I think we found that we can tailor a little more than we did in phase one. Back then in the spring when everything was on fire, we did what we thought we had to do to shut the door. I think we looked at Europe and other places where they didn't shut down schools. They kept their schools open, and they kept their schools open with a very low infection rate within the classroom. So I think it'd be different this time. I think right now we're watching the metrics. We'll have more to say in a week or so.
And for Commissioner Siegel, is it hard to catch people? You need video evidence. What can people send in regards to complaints? They need to just call you, or is the video help, or how hard is it to take away a liquor license?
So it depends. We look for, and the ones we've gotten, these have been referrals from local law enforcement departments of local health departments. They need to provide us, in those cases, an investigative report. So they have, their police officer, for example, in this most recent case, who sort of has gone in really documents what they saw or observed. I would recommend, if you're just an ordinary citizen, you can certainly send us a complaint. We would follow up and look into it. Or if it's an ongoing event at that moment, let local law enforcement know right away so they can go out there, document it, and take action, and then, if appropriate, make a referral to us. So that would be the best way. But yeah, if you wanted to take pictures and have that available to share, that certainly helps as well.
Has anybody been fined $10,000 yet?
So the Department of Consumer Protection doesn't issue those fines?
Correct. I was actually asking the governor if anybody's heard if there's been a fine for $10,000.
I don't believe so, no.
NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. In terms of the vaccines, do we have an update in terms of how many doses the state will be receiving in the initial delivery and how those are now going to be split between the hospitals and the nursing homes?
Why don't you take that, Josh?
Sure. Yeah, the numbers that the governor shared last week have remained relatively stable. So we still expect to receive just shy of 32,000 doses in the first week from our first week order. And as the governor previously announced, we're going to be splitting those equally between our healthcare facilities, our hospitals, and CVS and Walgreens on its way into our nursing homes.
And the people who are going to be receiving these doses, are they going to be given any type of paperwork that will signify that they have received the vaccine in case that might be needed at some point?
Yes, there's a very robust process through which people will need to register in the system, provide a consent to receive the vaccine, particularly in the case of the nursing homes. And then that will be tracked. They'll be obviously noticed when they need to come back for their second dose. That will be tracked, and there will be paperwork that the individual will receive associated with that. So there is a process in place to make sure all that tracking exists.
And just finally, has there been any contact with the folks at Pfizer's facility in Groton? Do we know from the state perspective what, if any, role Pfizer's Groton facility is taking part in terms of the distribution and the manufacturing of the vaccine?
Yeah. They're not involved in the distribution or the manufacturing. They were really involved in the research and development and the safety studies. So the manufacturing is taking place, I believe, at a facility of Pfizer's out in Michigan, and one other site as well. So the great work that was done in Groton is kind of done and is evidenced in the really incredible data that was presented to the FDA's committee today.
And Governor, just finally, how quickly do you think we're going to see the impact of the vaccine on hospitalizations and fatalities?
I think it's going to take, I'm afraid, at least a month, but I think, you'll see first, hopefully, our doctors and nurses who don't have to maybe quarantine quite as long to be able to get back. You'll see some of that in January, which I think would be a big plus. As I mentioned before, hopefully you'll see fewer fatalities in the nursing homes, but that'll still take at least a month.
Okay, thank you.
News 12 Connecticut.
Good afternoon. Can someone go over the exact transportation of the vaccine if it's approved? Do we know where exactly it's coming from, how it's being shipped here, and then where it's going to be stored specifically before it reaches, or is it going straight to the hospitals and areas it needs to be?
Yeah, so for the shipments to the hospitals, the shipments will come direct from the Pfizer warehouse via UPS and FedEx actually have contracts to help distribute. You may have read that they have GPS devices in all of the shipping containers. They're taking extraordinary precautions and safety to make sure they get where they're going safely. From there, they go directly to the hospitals in Connecticut that have the ultra low temperature freezers for this first week's shipment. We're not talking about all the specific locations just for a little extra safety. I know some hospitals have kind of self-disclosed, but generally it's in good hands once they arrive here in Connecticut with our hospitals. And then, as the governor mentioned, for the doses that are going into our nursing homes, those are handled via CVS and Walgreens. They have an extensive distribution network established and ready to go. Commissioner Gifford and I have been meeting with them regularly to ensure that they are prepared for the distribution and the administration clinics that are going to need to start occurring at our nursing homes in the coming weeks.
Fox 61.
Hi, Governors. Nia Maldonado, Fox 61. What's your message to those teachers that were rallying outside of the Capitol today asking for full virtual learning? But also, what do you say to many parents that don't want their students switching to full virtual learning? It seems to be a double-edged sword.
Well, the parents and the kids, have the option of staying at home, full virtual, or hopefully a classroom option, because there's nothing like in-person education, especially now, especially given all the isolation and distress people are going through. I just say to the teachers, we've got, 10 days left in this school year. I would say we're doing everything we can to keep you safe. We've got some volunteers or apprentice teachers there. If you've got to quarantine and Zoom learn, I looked at the checklist of things. I think we're following that as closely as we can. We've got the dashboard that gives you updates on what's going on in all the different schools. Track and Trace gives you what's going on in your school in almost real time. And your public health and safety is of paramount importance to us, and I'm doing everything I can to keep you safe.
And then I know we talked about Walgreens and CVS, but any plans on putting together big-scale vaccine distribution sites in the coming months? For example, New York and New Jersey announced they're going to be using empty Kmart stores for vaccine distribution. So wondering if Connecticut has any similar plans.
Got that, Josh?
Yeah, so great question. So what we've been talking about so far is really for the first couple of weeks of Phase 1A with our hospitals and our healthcare workers and our nursing homes. In parallel to this, our Department of Public Health has been working for weeks now to enroll additional providers in our vaccination program. So you will see vaccine clinics in the coming weeks and months at places like our federally qualified health centers, at our local health departments will be conducting vaccination programs. Local other pharmacies, in addition to CVS and Walgreens, under Commissioner Siegel's guidance, have been authorized, and more. You're seeing some of our larger healthcare systems as well scaling up for large-scale vaccination, even once they get done with their own employees, probably providing additional vaccination capacity for the general community down the road as well. So, yes, you will see a very dramatic and large-scale ramp-up of administration sites across the state.
WTIC 1080 News.
Hi, beyond Phase 1 with vaccinations, are you getting assurances from Pfizer and the other companies that the supply will remain strong through 2021? We're talking many hundreds of thousands of doses.
Yeah, so far, so good. The numbers that the governor laid out last week in terms of what's been forecasted to us in the coming weeks is stable. It fluctuates a little bit here and there week by week, and I'm sure it will continue to do so as we go forward. But so far, we've heard nothing but optimism from the manufacturers about their ability to continue to scale up in the coming months.
And have you talked about what happens if the supply dwindles at some point, so you can avoid a, Titanic in the lifeboat situation, deciding who gets what?
I think we have our priority in terms of, in terms of who's getting what when. I think when they get their first dose, they're holding back the second dose, so that would not be held up. You'd be able to have access to your second dose as well. Can I just say, from my personal point of view, I think the federal government is getting this as right today as they got it wrong with PPE 8 months ago, when they said, states, you're on your own, go for it, see if you have a friend in China, and it was a mad scramble. This time, not perfect, but they made, massive purchases from Pfizer, big purchases from Moderna, AstraZeneca, if they're coming along as well. They've got a way to get this distributed to each of the 50 states plus the territories. My fingers are crossed, we got it right this time.
Thank you.
The Associated Press.
Thank you. Good afternoon, everyone. Regarding AstraZeneca and Moderna, I know we have orders with Moderna. Do we have orders with AstraZeneca? And where do things stand with those?
They're still a few weeks behind us, aren't they, Josh?
Yeah, AstraZeneca has not submitted data yet to the FDA, so they are still, as the governor said, several weeks behind.
So right now we're primarily relying on Pfizer. Can you give us sort of more of a detailed breakdown of how many people you think will be fully vaccinated with both doses and by when?
Pfizer and Moderna, I might say, they're coming on in a week as well. Josh, you want to run through that?
That's right. So no changes from what the governor shared in the press conference last week. The expectation is that between our healthcare workers, our medical first responders, and our nursing home residents and staff, we'd expect to have a first dose administered to that entire population by early to mid-January, and then a second dose by the end of January. So that population, we're hopeful on the current trajectory to be done by the end of January, and then looking into phase 1B as we get with the first dose towards mid to late January, and then on into February.
I'm sorry, but how many people are we talking about?
I believe it was about 240,000 in phase 1A across those populations, the majority of whom are in our healthcare workforce.
So by the end of January, we should have 240,000 people fully vaccinated.
Yeah, in that range.
And do you know, regarding the prisons, are staff members going to be vaccinated before inmates? If so, why?
So now you're into phase 1B. The federal advisory board has not yet made recommendations about any kind of further sub-prioritization within phase 1B. We eagerly await their guidance, and our local allocation committee of the governor's vaccine advisory group will, as they have done throughout, take on board those recommendations and then see if there's further adjustments we think are appropriate for the state of Connecticut to recommend to the governor for his review and approval. So we haven't gotten there yet. So more to come on that in the coming weeks.
And when will the final vaccination plan be available publicly? I've requested it, and I haven't been able to get a copy yet.
I'm not sure what, as we've been discussing, the plan is coming together as we go based on, additional guidance from the federal government on recommended prioritization as the inventory of vaccines, more clarity is provided around, what we should expect in the coming months. So it's a constant work in progress, and that's why we're doing these press conferences multiple times a week to keep everyone updated on the very latest.
Okay,
Yeah.
I just understand that most states have submitted actual document, that they've released documents publicly for a plan.
Well, so there was a plan submitted by the DPH a couple weeks ago, I think, a preliminary plan, but,
Right.
Again, that is subject to change, and we can certainly provide you with a copy of that if you'd like. I think it's posted publicly.
Okay, thank you.
The Day of New London.
Hi, I was wondering if you could talk a bit about, in terms of how the state will be tracking data about, how many people or what percentage of nursing home staff, residents, or healthcare workers get the vaccine, and what of that information would be publicly available.
All right, great question. So I'm not going to take us too far down in the weeds here and bore everyone to death, but just at a high level, there are two data systems that will be tracking all the vaccinations. One is a federal system that the state of Connecticut has elected to use for most instances to track vaccinations. There is an existing state vaccine database as well that some of our existing hospitals already have integrations established with that will be used in certain instances. So we'll be tracking data in two systems. We're looking to integrate those two so that we can bring it all together in one place. But we do plan to report on a regular basis, probably in each one of these press conferences in the coming weeks and months, the up-to-date data on how many vaccines have been administered and in which categories. And so you'll see much more to come on that, as we start to really begin administrations in large scale.
CT News Junkie.
Thanks, Max. Governor, given the situation now and the modeling for the next couple of months, do you anticipate needing to extend your emergency powers in February?
Well, the legislature comes back in about a month, so I guess it may be open for discussion. But I'd like to think that we can get back to a normal course of action very soon. I'd like to see that the legislature really get back in the building relatively soon. So I think it's too early to say.
Okay. I wonder if you might sort of describe the experience of being governor during these past 9 months. You've had sort of unprecedented authority during a stressful period for the state. What's that been like for you?
That's I mean, every day things change. And I was on the call with the White House. I was, a little tough on them, in terms of where they were 6 months ago. Everybody was going as best they could. And the facts were changing every day. And, I was blessed with having, a great team around me, some of whom you see them on with me today. We've got some of the best scientific people, and I knew what I knew, and I knew what I didn't know, and I listened. And I just figured that my job was to take the best information I could from the best people I could and try and explain it as best I can. I think, I can't do this by mandate, as I've said before. It's not like you just lock it down or fine you or arrest you. That's not the way it works. This is a situation where people have to have a sense of direction, have to have a sense of confidence, have a sense of trust that we're doing the best we can in a really complicated situation to keep you safe. And I welcome the challenge and the opportunity to make a difference.
Okay. Do you think that the state laws that these emergency powers are sort of derived from, do you think that they've worked as intended throughout this whole public health crisis?
Well, I'm probably not the most objective person, but I think they have. I mean, I tried to keep to my lane. I tried to say whatever I do on an emergency basis, I do in the name of public health and related to COVID. People wanted me to shut down gun stores or, tear up labor contracts. That's not what this is about. These powers are about emergency powers to keep you safe during a fast-changing COVID situation. But this is not the norm in elective government.
Okay, thank you. I appreciate it.
The Waterbury Republican American.
Thank you. Sorry about that. Josh, I just wanted to follow up on Sue Haig's question. You said 240,000 people in the first round, but the schedule last week was 380,000. Can you explain the difference, please?
I'll go back and pull up the charts from last week. They're not, the population size has not changed. So, the universe that we're talking about in phase 1A between the healthcare workforce, nursing home residents and staff, and medical first responders, that's the first tranche here.
Yeah, but I thought it was 204,000 among the medical workers, 22,000 nursing home, and 6,000 medical responders. So that's the number we should go with, the numbers?
Yeah, so isn't that about 240,000, 230,000, 240,000 in that range, right?
Yeah, okay. All right. And then I believe you said the other day that 1 million were expected in the second round, whatever you guys are calling it, 1A or 2A or 1B, I forget what it is.
That's right. But by the way, that 40,000 in wave one, that was under an assumption that 80% of the people in those populations elect to receive the vaccine. So that can vary, right? That's an estimate. And yes, for phase 1B, that's, about 1.5 million people in all the categories that we had described there between, the critical workforce, people who live in congregate settings, whether those are prisons or group homes or homeless shelters, and then all adults over 65 who are obviously at high risk, and then anyone under 65 who has a pre-existing condition that puts them at high risk. So that is a large number of people, as you point out, and that's why we eagerly await additional guidance from the CDC panel on recommended prioritization that our local vaccine advisory group can take up and bring forward to the governor.
Governor, could you perhaps provide us a little more of your thinking or your planning, I should say, regarding the restaurant aid that you discussed briefly during a virtual news conference yesterday? A question came up, and basically you said that you were looking at ways to provide state assistance, basically as sort of a stopgap until some federal assistance arrives, or more federal assistance arrives. Could you provide us a little more on what's happening with that?
Yeah, Paul. We're going to try and do our best, but let me tell you, we got our CARES Act money many months ago. Melissa made sure it was budgeted out through December 31st. There was not a lot of leftover in that money, but that said, I know the incredible distress that small business, in particular our restaurants, are going through. By the way, you can open them or close them. I hear all the arguments. But their reservations, the number of people going there is way down. And I know how important they are to our communities and our towns. So we're going to do what we can. But I've said that to a lot of different groups.
Okay. Has any decision been made regarding when it comes to vaccinating high-risk employees in hospitals? Will that also include non-medical staff who work in emergency rooms and intensive care units where COVID patients are being treated?
I think it will, yes.
And have we seen any signs, or has there been any contract tracing showing? I know there was the party in high school party in Avon, but has there been any contract tracing linking increases in infections or mini outbreaks or flare-ups to Thanksgiving gatherings?
Well, I think you can see the numbers. Obviously, the infections have gone up, especially over the last week or so. Some of that may be related to the social gatherings in and around Thanksgiving. Some of that may be related to thousands of college students leaving and coming and the back and forth there. Talking to my fellow governors, we're all analyzing the track and trace information, and the overwhelming majority of the infections seem to come from those informal social gatherings. I've said that before, and that sort of impacts your thinking about opening and closing things.
Okay, thank you very much.
Hearst, Connecticut Media.
Thanks, Max. This one's probably for Josh. I was hoping to get some clarity around whether nursing home workers are going to be vaccinated the same day as the staff. I had talked to a home operator earlier today, and they said that it's going to be one clinic, but I know it was brought up during a previous press conference that they're going to be vaccinated along with other healthcare workers, so I was just hoping to get clarity on that point.
Yes, so it's correct that they will. The nursing home staff will be vaccinated at the same time as the residents. So CVS or Walgreens will come on site. They'll set up shop there for the day, and they will go through all residents, all staff. It will create some challenges for the homes because, as they operate 3 shifts, they may need to call in people who are off shift on that particular day to get their vaccine. And each of those operators under the Warp Speed contract that they're under are obligated to provide 3 separate clinics to each home. So, one for the first dose, one for the second dose, and then a third one to ensure that, anyone who may be out, unavailable, whatever for those days, there's additional opportunities to make sure everyone has the opportunity to get both doses.
Thanks. And then my second question is for you, Governor. A group of gym owners wrote a petition countering the letter from doctors a few weeks ago. They want the gyms to remain open, and they're arguing it's not a major source of spread. Are there any plans to close gyms at this point? And do you maintain that they're not a major source of spread?
They're not a major source of spread, but everything's a small source of spread. And when you have a 7% positivity rate in more community spread, you keep a look at this all the time. That said, we've got our exercise classes and the such. They're limited to 25% capacity wearing the mask. So we're doing everything we can to keep these places open safely.
Thanks. And then one more. Is the drop in hospitalizations due to the number of deaths today? And can I get a percentage on the beds remaining and the percent of ICU beds that are taken up by COVID patients?
Yeah, I think I said that, but let's see here. Do you have that right in front of you, Josh?
Sure. So to your first question about the deaths, remember, only about half of the deaths that occur from COVID are happening in the hospitals, so it's usually about half of the total number that's reported. And then that is usually a small portion of the relative to the number of healthy discharges that occur on a given day from the hospital, which is usually 90% higher number than the number of people dying in the hospital. So still the vast majority of people who are admitted do leave healthy. The percentages for today are this is again a statewide total. 78% of beds are occupied, 59% of ICU beds are occupied, and of those, 36% of the ICU beds are occupied by COVID patients. It is worth pointing out that that's a statewide average. When you go look at an individual hospital, there are certainly some that have much higher percentages than the statewide average, as you'd expect, and some that have much lower averages. And so we do track that very carefully. Commissioner Gifford and our team at Department of Public Health, we're in regular contact with our hospitals, gauging that capacity and making sure we're taking every appropriate action to ensure that they have the capacity they need to respond to the challenges.
I might just add to that, as Josh said, 2/3 of the folks in the ICUs are not related to COVID. 2/3 are related to different types of surgeries. Some of them are urgent surgeries, and you can't put them off. Some of those are elective surgeries, and we have some flexibility there. So you see different ways that we can expand capacity as needed, at least in the near term.
Thank you, everyone.
The Hartford Current.
Hey everyone, this is Emily Brindley from The Current. Governor, first question for you. So over the summer months, obviously, we saw a lull in COVID cases and deaths and hospitalizations, those great months that I'm sure we all wish we could return to. And now Connecticut is just a little bit above the national average in case count and in active hospitalizations per capita, and a little bit more above in daily deaths per capita. Can you kind of like talk me through how we got to where we are now? Like how did we go from those calm summer months to where we are now?
Well, I'd rephrase that a little bit. We have a lot of infections, but we're also doing more testing than just about any state in the country, except for two, Massachusetts, and I can't remember who it was. That's worth remembering as a trend. Our positivity rate, you're right, it's gone from 1% to well over 6%. But you've got to keep that in perspective that across the country, the overall rate for the country is about 10.5%. But I'm not dismissing this. The trend line is not going in the right direction for us. It's not going in the right direction for Rhode Island, which has a much higher rate. Massachusetts has gone up quite a bit. New York, thankfully, has done a little bit better, but of late they've gone up quite a bit as well. So I think you're going to find that we can do a lot of mitigation ourselves, Emily, within our four walls of our state, but we're not an island, which is why we got to do everything we can on a regional basis to see if we can bend the curve.
Governor, can I just make one more point?
Yeah.
Emily, it's very important that you be aware also that you cannot compare death rates across states. Our team at the Chief Medical Officer's Medical Examiner's Office and our Department of Public Health, they go to extraordinary lengths to ensure that every death in Connecticut that is either directly attributable to COVID or is suspected to have been COVID related is counted in our statistics. It has been well documented at this point that most states are not going to those efforts, or in some cases, there's been some articles written that some are kind of very clearly understating the death count for COVID. And yet mysteriously having huge spikes in pneumonia-related deaths. So this is a pet peeve of mine because it's apples and oranges. So I think just want to make sure that that's clear as well.
Thank you. I appreciate that. And Governor, another question for you. So you've talked a lot, over the course of the entire pandemic, really, that you put public health first. And so could you just kind of walk us through the medical experts that you consult on a regular basis, the people who you rely on, and can you talk to us about how frequently you talk to those medical experts?
Oh, yeah. I mean, I talk Dr. Coe, I talk to Scott Gottlieb, I talk to Zeke, I talk to Deirdre every 3 hours, the poor lady. So I talk to as many folks as I can. Look, everybody wears their own hat. Some people say, you heard the other day, indoor eating is dangerous. And then I say, all right, well, you shut down restaurants, so they stop eating indoors. Do they go to somebody's home? Are they more likely to be just with their coterie of friends or broader? Every action, there's a reaction. So those are the type of discussions we have with the healthcare communities. We try and find the right balance to keep people safe. But the bottom line is public health.
And just to get into specifics here, you mentioned Scott Gottlieb and Zeke Emanuel. When was the last time that you spoke with either of those people?
Oh, man, I think Scott was this week. Zeke was probably a week or two ago.
Okay, thank you. And one last question for you. Do you have any concerns about hospital or nursing home staff declining to receive the vaccine? Is that a concern that's kind of on your radar right now?
Look, I think I'm going to let the hospitals deal with that in terms of how they think best to manage it. Right now, we're trying to get vaccines out, so there'll be a supply and demand issue. I think it's very important that people get vaccinated there. I think about that in terms of the schools in New York. They just reopened the schools for the younger grades, and they're mandating that people get the vaccine, mandating that teachers get vaccinated. And if they don't, they're relieved without pay. So, but I don't think we have to do that in Connecticut. I think most people overwhelmingly over time are going to voluntarily get the vaccine. I think we already have some history building in Britain. Canada's doing this. I think you're going to look around in a month or two, see your friends have done it. They've done it safely. They're feeling more confident that they've been vaccinated. And I think this is going to sort itself out.
And specifically for hospital and nursing home staff, does the state have any plans to encourage vaccination in some more substantial way, a messaging campaign, anything like that?
Oh, we have a big messaging campaign. I think you saw in that graph, we've got our communications team. They include hospitals, talking to that group there, making sure the medical professionals lead by example. Maybe some of the lead docs get the vaccination. Maybe a couple of leading political people get the vaccination early on. We're certainly talking to the ministers, getting into the religious communities, doing everything we can to reinforce how important it is for you and your community to get vaccinated.
All right, thank you all. I appreciate it.
The Connecticut Mirror.
Governor, in your conversations with Governor Raimondo, have you got any insight as to what accounts for Rhode Island being having the highest per capita case rate in the United States? It's roughly double the U.S. case rate.
Paz, we've talked about it. We've postulated. They have a lot of people. They come in from Texas. They go to Newport. That was in August. There's some slight differences between Rhode Island and Connecticut, but I can't put my finger on it.
Are there any hospitals that are approaching 100% on occupancy? Or let me phrase that another way. Can you identify the hospitals that are have the highest occupancy rates for total beds and ICUs?
You have a breakout on that, Josh?
Yeah, and this is public information. I know that's being reported to HHS. So I mean, again, I share this, but again, recognize that these numbers change day to day. So even by the time I get done reporting on yesterday's data, today's data could be different. But in terms of total occupancy, it looks like St. Mary's was around 90% total, and Stanford Hospital was around 90% total. Those are the two highest in the state. And in terms of ICU capacity, Manchester Memorial and St. Francis were among the highest total capacity. But again, it fluctuates. And those are the highest, and so that obviously you can tell no one at 100%.
What were those capacities for the ICUs?
St. Francis looked like 92%, and Manchester at 90%.
And I don't know if Commissioner Siegel's still on the call, but what's the total now for how many liquor licenses have been suspended, and where was that most recent case that she described?
So there's been total of 3 that we've sort of summarily suspended based on these violations of the sector rules. The most recent was in Hamden.
Okay, that from a few days ago. Okay. All right, thank you all.
All right, Mulaney's giving me the signal. Let me just say, from the nature of your questions about the vaccine and how important that is in terms of our mental health as well as our physical health, I'm just struck by the incredible complexity of this management task in terms of the segueing, the different vaccines, different refrigeration, different timing when you get it, how you prioritize, how you get that out there. And I just want to say, my team, I'm blessed with the best people I could ask to help manage my way through this. Paul and Michelle are here today. Josh, who comes out of a management background, thank God. Look at the management task we got in front of us. It's going to be tough, and we're going to do it, and we're going to do it right. And I think this is going to be a new spring for Connecticut and our country. Thanks, everybody.